right, everybody, welcome back to the Little Brain Campaign. I am your host, Dr. Lauren LaRose. I am a board certified child and adolescent psychiatrist and adult psychiatrist with a private practice in Metairie, Louisiana. And today I have the honor of speaking with Dr. Susan Fox. She is a board certified expert in reproductive health and fertility with over 24 years experience. She has helped many clients achieve a healthy pregnancy, have beautiful babies, and thrive postpartum and within their family life afterwards. I was a guest on her podcast a few months ago, and she has graciously agreed to come on my podcast today. So thank you for being here.
Oh, thank you so much for having me. It's really a delight to see you again, and I'm looking forward to the conversation.
Yes. Okay, so tell us a little bit about what you do in
Yes.
your practice. How did you get to this point in your career?
Yes. So, as mentioned, for 24 years, my focus has been fertility, which
Hmm.
naturally rolls into pregnancy and postpartum, and then also naturally rolls into what I call the pre-perimenopausal phase.
Yep.
But for fertility, it's really been the most of my practice, both
Hmm.
in private practice and in an online course that I offer so that I can help people outside of my zip code.
Hmm.
And so I practice Chinese medicine. I'm a doctor of Chinese medicine and acupuncture. And I use the 5 element model to really help patients and clients understand for themselves what might be going a little sideways so that they're not limited to whatever is their diagnosis, and especially if it's unexplained infertility.
Hmm.
But the beauty, the elegance of Chinese medicine and most of the traditional medicines is that we can really help them viscerally understand where things might be going a little bit sideways so they can get back to balance, homeostasis. Their bodies can heal and they can become pregnant either naturally or through IVF.
Okay. So is this something like as a little girl, you grew up wanting to be a doctor of Chinese medicine, or how did you get
Well,
to this
that's
point?
thank you. That's actually a good question. Not so much a little girl, but really I got exposed at 17 years old myself,
Okay.
or 18 years old. And it was way back when Chinese medicine was just brought into the US.
Uh-huh.
And it was due to the fact that I was having, and you'll appreciate this, and your audience will appreciate this. I was bounced back and forth between gastroenterology and psychiatry because
Yep.
I was having digestive disorder that
Hmm.
that was not visible on any lab or test. And it wasn't until I tried acupuncture and Chinese medicine that I was able to make the complete and just irrevocable link that
Wow.
that it was the grief that I was experiencing over the loss of my dad that was
Oh,
having my guts literally be tied up in knots,
wow.
and it really began an amazing healing process.
Hmm.
So, fast forward 25 years later, I was in the corporate world at the time. I stayed in the corporate world. I was enamored with and forever a patient of Chinese medicine, but it wasn't until my own child was ready to, kind of go into preschool that I thought, okay, do I go back into the corporate world or do I do this thing that really is my heart's desire? So at age 40, I went to school and got my master's. And at age 60, went back and got my doctorate so that I could, really deliver to patients.
Wow. So
Yeah.
it's like a whole new career in
Whole
this
new
new
career.
chapter of your life.
Exactly.
Okay, so tell us what kind of issues do you see arise in your clients, and
Mm.
what are you doing to
Yeah.
help them with these
Yeah.
issues?
So oftentimes they've come into me, kind of late in the game, if you will.
Mhm.
If very few are saying, I think I might want to have children someday and my periods are a little bit wonky. Let's go look into this. It's usually I've been trying for 6, 9, 12 months, 2, 3 years. I've had multiple failed IVF cycles. Now, can you help me? And the answer is still yes. But if the viewers or listeners are out there, please don't wait that long because
Yeah.
time is a factor.
Yeah.
And so what I'll do the Chinese medicine thorough intake, and I kind of combine it with functional medicine. So I'm able to, review and recommend labs. So if they do get to come in before they've gone through an IVF cycle, I'm able to say, let's get these labs. So by the time you see your reproductive endocrinologist, we've got some data to provide. But
Mhm.
it's also more than just their their female hormone panel that
Hmm.
needs to be tested. And we've had this conversation as well. I mean, what often gets overlooked, especially for things like recurrent miscarriage or unexplained infertility, is mom's body, like her own physiology.
Yeah.
How are her vitamin D levels? Is she having any sort of chronic silent infections? What are her thyroid levels like? Because
Hmm.
again, we have a preponderance of autoimmune, well, activity throughout our body, but especially women in their reproductive years tend to have more inclination toward autoimmune thyroid. And so if we can make some adjustments, and they can get some thyroid medication, because as we know, thyroid goes a little bit up and down in pregnancy anyway.
Right.
We can change some of the parameters that are going to that would otherwise set them up for a loss, or a clinical.
Right. Right.
Yeah.
So you're really helping patients to dig down to figure out like what else is going on physiologically in your body that could be interfering with
Yes.
fertility.
Yes. And we talk, what I call the four pillars. We talk nutrition and hydration, because a lot of times people think they're doing well, but they're having, sort of the healthier bar for breakfast with,
Hmm.
their healthier latte. And,
Hmm.
and so we really talk about the importance of whole foods,
Yep.
clean water. I mean, that is a conversation I have so often. I mean, we know that our tap water is as good as it can be through the municipalities, but that's
Hmm.
a very low threshold, because
Yeah.
otherwise it would be unaffordable for us. So
Right.
I'm always talking about the importance of, a reverse osmosis or carbon filtered water. Obviously, get rid of all the plastics,
Hmm.
get rid of all of the plastics and phthalates and parabens that are in your, personal care products and your home cleaning products, and, kind of switch to more natural fibers, because if you're
Yeah.
sleeping on polyester, you're breathing in endocrine disruptors. And really, people who are very, very, very smart, you can see their eyes kind of like light up, like, oh my goodness, I've just never thought of it. So
Yep.
it's not, it's truly an ignorance issue. And we're
Hmm.
so inundated with marketing for all of the things, the
Yep.
latest fragrance. Please don't use fragrance, people. That we don't realize the implications it's having on our bodies. And then,
Yeah.
of course, I use acupuncture. That's one of the main tools in our trade, to really help increase blood flow to ovaries in the first half of the cycle, and then to uterus in the second half of a cycle. And then there are modules that I can let them take home and do at home, where they're
Hmm.
not doing needles, but they're doing a TENS machine to get acupoint stimulation.
Okay. Can you tell
Yeah.
us about that? Because
So
most
this
people are
is
probably
this
not familiar with that.
this is my I could talk about this until the cows come home, because I think it's brilliant that someone else, kind of discovered this. And there's research that has shown that it's called transcutaneous electrical acupoint stimulation, and it
Okay.
uses a TENS machine. We know that through sort of the PT model of,
Hmm.
we've hurt our shoulder, and we put the electricity on to kind of drive blood flow. Well, we do it to acupuncture points
Okay.
that are, along the lines of the ovaries and uterus, and then other points that we know in Chinese medicine open the flow to these points.
Uh-huh.
And it has been shown to increase live birth rate for women over 35 undergoing frozen embryo transfer. So we know that's a cohort of, women who are struggling already, by
Yeah.
42%.
Wow.
Yeah, I mean, like, that's an enormous increase. And so I just wish everybody could do this. And you can reach out to me. You can, because it is
Yeah.
done in the comfort of your own home. So you're not
Right.
running to another series of appointments. We're all far too busy anyway. So, every other day from the end of a menstrual bleed until ovulation, if you're trying to conceive that month, or until an egg retrieval, if you're going through an IVF cycle, or until the next cycle day one, if you're skipping a month, you're getting this increased circulation to ovaries and uterus, so that they can function better.
Wow. I wonder, and you might know the answer to this, like how often are IVF doctors recommending that on their own?
None
Oh no.
that I'm aware of, because it is a Chinese medicine
Okay.
Although it's so easy to be done,
Yeah.
it would really be an easy thing. But in the defense of the IVF docs, by the time someone's walking into their door, their job is to, stimulate, retrieve, make embryos,
Right.
transfer. So
Right.
it's just not in their wheelhouse,
Right.
but it is in mine, and I'm able to do it across state lines. In California, I can do acupuncture, I can do my Chinese medicine, but anywhere in the U.S., I can, send these TENS machines and hook you up to the modules, and you can just go for it. I mean, I've actually had a woman in Dubai who
Wow.
would fly in for her IVF cycle, but obviously couldn't, come in for regular acupuncture. So she did this in Dubai. I've had women in New York and Atlanta and DC and Chicago. It really is something that's very helpful.
Yeah, and non-invasive, and it's not taking
Non-invasive.
another medication or getting
Nope.
another injection or
Nope.
yeah.
Nope. Nope.
Wow. So is that device something that's helpful for other conditions other than infertility?
Well, probably is my answer, but I don't have protocols for that because
Okay.
I'm really focusing on fertility. But just, if I'm thinking of like, even birth prep, right?
Yeah.
We get it, we use it in birth prep, but I can't speak to it with certainty because I'm a data driven gal.
Right.
So
Right.
if the research isn't there, I tend to, not postulate. I tend to zip it.
Right, right. Okay, but that's fascinating, and I hope that, like, I have a few patients in my mind right now that struggle with infertility, and I'm like, I need to tell them. I mean, is that something that people can just buy that machine on their own, or
Well, I mean, they could buy it on their own, but they wouldn't know what to do with it, right? So,
right,
so the
right,
protocols are intellectual property.
right.
So it's something, and the modules describe exactly, here's how to set it up.
Got it.
Here are the parameters to set it up, and then here are the three separate protocols that you would do every other day. So
Okay, well, I might be sending a patient your way.
please
I'm gonna
do,
email you about that after.
please
Um,
do. It would help.
okay, so, um, tell us, like, what are some of the most common causes of infertility that you see in your
Yeah,
practice?
I would say probably the most common that I see are PCOS, polycystic ovarian
Yeah.
syndrome, because we are, again, a polluted society. And if we can
Yep.
help clean up the metabolic dysregulation, we can clear out that PCOS, and that person can get pregnant. And again, we also know that PCOS is a metabolic condition that affects a person far beyond her fertile years. So
Yeah.
it's important to get that regulated and healed
Right.
sooner than later. Endometriosis, I see a lot,
Mhm.
and sometimes it's again, endo is kind of really hard to diagnose. Although, heads up, everybody, there is a just last week released blood test
Oh,
that has biomarkers that have I can't even remember what the specificity is, but it is remarkable. I was attending the Pacific Coast Reproductive Society annual meeting and left a lecture where the doc was saying it's, something's coming soon, and went into the exhibit hall, and there's the something. I
wow.
can put that link into,
Yeah, that'd be great.
yeah, it requires at least somebody who's going to be able to do the blood draw. So usually
Okay.
it's a medical doctor, or Chinese medicine doc, or somebody who can order your blood draw, or might have
Right.
the phlebotomist in house, or because you can't really take the kit with you to Quest or LabCorp and say, can you do
Okay.
this blood draw? So it's really,
Okay.
I hope that one day it will become that DIY, but
Yeah.
it's just released. So yeah, but it's very
Okay.
exciting. So yeah, PCOS and endo, and then diminished ovarian reserve is the third one, because we're starting later.
Mhm.
Our lifestyle is such that it's affecting our egg count and quality, and
Yeah.
so we do a lot to really help maximize the eggs that are coming up, the follicle recruitment that's coming up each month, so that there's a better chance of success. And that is that, once again, that tease has shown that that's a cohort. The women over 35
Yeah.
undergoing frozen embryo transfer is kind of presumed to be the diminished ovarian reserve patient. But
Mhm.
what I'm able to do, and I think that this is important, is that I'm able to really impress upon the person that they are not their diagnosis, that their
Yeah.
diagnosis is simply explaining what went sideways. And so we used, all of the tools of Chinese medicine where we're talking about, do you run hot or cold? Are you more deficient or excess? Do you tend to be more red in the face or more pale? What's the quality of your menstrual bleeding?
Mhm.
So we can really just help them kind of regain agency over, yes, this is a diagnosis and there's something I can do about it to change the outcome for the
Okay.
better.
So what would a treatment plan look like, let's say, for someone with PCOS who
For
comes to
someone with
see you?
PCOS, I would be using supplements,
Mhm.
certainly diet. I'd be having that person be, again, only whole foods, pretty low carb, high protein, lots of veggies for the fiber to help really remove a lot of the recirculating hormones that are part of that picture.
Mhm.
And then I would be using acupuncture to help clear. We refer to PCOS as like a phlegm condition. There's like an accumulation of unruptured follicles. In fact,
Okay.
the name PCOS, cystic, they're not cysts. They're unruptured follicles that should have been reabsorbed in the body, digested,
Mhm.
if you will, but they're hanging around because of this metabolic and then therefore hormonal dysregulation. So we try to help clear the deck. We use supplements like the inositols because they're shown to really help, especially the D-chiro is helpful for blood sugar. And then the myo-inositol are really great for improving mitochondrial function.
Okay.
And then we use other supplements like DIM. I don't know if that's
Yeah.
yeah. So because it's derived from cruciferous vegetables, it will neutralize these recirculating hormones, and then we add fiber to the supplement regimen so that we can excrete them through feces. So that we're trying to just really only have the hormones in the body that are being produced and used, and then they need to get pooped out.
Right. Okay. So just to like get super simplified on this,
Yes.
like what are these hormones that are recirculating that are causing problems? Like which
Yeah.
ones?
So, well, first, the first culprit is cortisol, right?
Okay.
And insulin, because upstream. And so, because they're having this sort of inflammatory effect at the level of the ovaries, the hormones that are recirculating are estrogens that are
Mhm.
not being cleared, testosterone that is being sort of excess secreted, if that makes sense,
Uh-huh.
at the theca cells of the ovaries. And that's pretty much it. It's if we start by clearing and regulating the cortisol and the insulin, we can reduce the inflammation, and then with the DIM, we can clear the excess estrogens and testosterones, androgens.
Okay.
Yeah,
And do you ever see um these individuals go into remission?
absolutely.
Okay. Okay.
Absolutely. Yep. Yep. Again, the whole diagnosis was an accumulation. I mean, there's a genetic component, right? So,
Right.
that switch got flipped on in a perfect storm of usually in the tween years of
Yeah.
hormones, kind of just coming, getting activated at the same time it's the, pizza, bagel, cereal time
Yep.
in a one a person's life. And so she's kind of setting the stage for that, weight accumulation, the inflammation, and then the irregular periods.
Okay.
So yeah, but
Okay.
yes, absolutely. You can resume normal periods, regular cycles, improve your metabolic health and picture so that you're good to go. Yeah.
Okay. And what about endometriosis? What would a treatment plan look like for that?
So with that one, it's more about trying to help digest, if you will, the accumulated endometrial tissue, because endometriosis is a diagnosis where the tissue that should have been shed through the vagina in a menstrual cycle has retrograded into the peritoneal cavity, into the abdominal
Mhm.
cavity,
Mhm.
and it typically will then attach to something. It's tissue, and so depending upon the amount, the size of that tissue, we can use proteolytic enzymes to help digest. So in that first half of the cycle before ovulation, I'll use enzymes like either a serrapeptase, a nattokinase, a lumbrokinase, if she's got a lot of pain, and between meals, so that it's looking for something to digest and it finds
Mhm.
that tissue and starts to, kind of scrubbing bubbles, like eat it up. And
Right.
yeah, and then again, we also will work with diet. We want to keep her on a really strict anti-inflammatory diet, because
Mhm.
endo is an inflammatory condition that can then become autoimmune.
Okay. Okay.
Yeah.
And do you see remission with those patients?
Sometimes, again, it
Okay.
depends upon how severe the endo has
Yeah.
gotten. So,
Yeah.
if she's really, just debilitated, either at ovulation and or in that second half of her cycle or menstruation, if she's unable to, defecate or
Mhm.
have intercourse, or is just in, severe pain, probably that tissue needs to be removed surgically.
Okay.
So, or if not surgically, the first course these days is to use Lupron and put
Mhm.
her into a 3-month kind of menopausal situation,
Okay.
where you're shutting down the hormonal symphony,
Okay.
just so that estrogen isn't being fed,
Okay. Okay.
that endo isn't being fed by estrogen.
Okay. So that like allows time for that tissue to kind of clear out,
Exactly,
basically.
exactly. It
Okay.
just atrophies because if the endometrial tissue is fed by estrogen
Right.
in that first half of our cycle when our follicles are growing. And so if we just, remove that, then they will, kind of get smaller, they'll atrophy, and hopefully just, kind of digest.
Right.
Yeah.
Right.
Yeah.
Okay. Okay. Um, are you seeing issue, because I know you and I talked about this a little bit when I was on your podcast.
Mhm.
Are you seeing women who don't necessarily have PCOS, they don't necessarily have endometriosis, but there's some kind of hormonal imbalance? Maybe in some cases, I know I see this, like they were on birth control for so many years for contraception,
Yeah.
and then things are just like not working well
Yeah.
when they get off of it.
Yeah. Yes, I see that a lot. And a lot of times that is the air quotes unexplained infertility. Everything looks
Yeah.
good on paper, but it's just not happening. If depending upon the time, depending upon the person's age, I may be saying to her, wait a minute, let's have you go get a hysterosalpingogram, an HSG, to make sure your tubes are open. Maybe you need a hysteroscopy to make sure there's nothing structural in the uterus.
Mhm.
But if that's already been checked and still things are just, pregnancy's not happening or cycles are not happening, there's a lot we can do to really just, again, it sounds so simple. And I know I just keep repeating myself, but we can do a lot to really help her uh, re-regulate. Because, a lot of times this is the person who is, up at night scrolling,
Yeah.
Netflixing until she's trying to, put her head to the pillow, not getting up to put her face to the sun in the morning. So her circadian rhythms are completely bonkers. And again, I'll run blood work if the person is a patient in the state of California, or I can
Mhm.
recommend blood work to just make sure we're not missing anything like autoimmunity markers
Right.
or low vitamin D or anemia.
Okay, okay.
Yeah.
And then do you work at all with, like, hormone replacement
I do
in it?
not. That's
Okay.
not in my it's not in my scope of I mean, I
Yeah.
do insofar as I'm oftentimes referring to
Right.
other medical doctors who can prescribe that. And thankfully in my area, I've got some really great resources. But for the fertility patient, hormone replacement is typically not what she needs, except
Right.
possibly some progesterone
Right.
support. So once again, we'll do that cycle day 21 or 7 days post ovulation lab. And if her progesterone is low, but everything else looks fine, I'll suggest that she ask her OB-GYN to give her a prescription for progesterone, just to give it, give it a chance, give a
Yeah.
potential embryo a chance. And then if she's pregnant, I'll recommend she stay on that progesterone for the first trimester.
Okay, okay.
Yeah.
And then let's talk about, because I know a lot of the listeners here are moms who are in perimenopause, approaching perimenopause, past perimenopause.
Yeah.
So let's talk about that
Okay.
also.
Okay. Well, there's nothing unnatural, right? That's my first thing. It's like perimenopause is, if we got lucky enough to live long enough that
Mhm.
our reproductive days are behind us, and we're now in, another phase of life. if and as we can, once again, be judicious with our nutrition, hydration, proper sleep, circadian rhythms, proper movement, we're less likely to have and emotional resilience. That's a big important one, of course. That's what you see a lot, I'm sure. That will help reduce the symptoms of
Mhm.
perimenopause. There are women who go through perimenopause and menopause without any symptoms. So
Mhm.
it really can be done. I purport the reason we have all of our symptoms is the accumulation of parabens, phthalates, toxins, microplastics, and so on and so forth, up until that time that the ovaries say, you know what, we're kind of done producing here. And the adrenals are like, sorry, we've got nothing left because it's been a pretty stressful 30s and 40s.
Yeah.
So we just have to kind of replenish that. So I'll work with a person that way first,
Mhm.
because sometimes she can buy some time. Because if she's still cycling, I try not to interfere with that cycling. If
Mhm.
it, if she's cycling, regularly and naturally, and then as soon as things get a little, longer cycles, shorter cycles, then I'll be like, okay, let's have you talk to someone who can prescribe some HRT, because you just may need some progesterone support to hold your cycle for that last 2 weeks of
Mhm.
your 28 days or 30 days, so that you're not bleeding every 15, 16 days.
Right. Right. Okay. 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 So if you could get in front of a family,
Yeah.
okay, where the daughter, we have a teenage daughter, because I see this all the time,
Mhm.
14, 15, 16, who's already been diagnosed with PCOS or
Mhm.
endometriosis. Um, what advice would you give them?
Yeah. I would say it's a team sport, so
Mhm.
it's a lot to ask of a tween or a teen to make these changes. But if the whole family is doing it, then she's not being isolated or somehow maligned for that.
Mhm.
She can't have Friday night pizza. Like,
Yeah.
let's change it so that instead of Friday night pizza, we have Friday night something else
Mhm.
that
Mhm.
has protein and veggies, and again, sometimes it's not just Friday night pizza. It's the donuts or the bagels or the
Yeah.
school after school snacks. Let's change after school snacks to be something healthier. If this person is not getting a lot of movement, if she's then let's increase exercise. Find something she loves to do. It doesn't have to be you know um, pickleball or being on the soccer team. I mean, it could be that maybe she volunteers to take the neighbor's dog for a walk each day and
Mhm.
gets an hour's worth of movement that way. If I really could rule the world, I would be really limiting homework, because I think the homework
Yeah.
makes kids, it sets them up for that. They got to get the homework done so that they're sitting down getting the homework done, and then it's dark o'clock and they can't get out. So
Yep.
I would also be making it a team sport with the teachers to say, is there a way we can do this differently,
Mhm.
so that they're getting their learning, but they don't have to be 7 hours after school getting homework done.
Yep, and not sleeping and not getting outside and not moving. Yep.
Yeah.
Mhm. Mhm.
I mean, really, we could. I mean, wouldn't it be wonderful to be able to have a sort of a live action learning of, I don't know, biology or chemistry, where you're out taking a walk and everybody has a role to play. You're the liver cell, you're the
Mhm.
pancreas cell, and then but you're moving and you're engaged and you're getting the sunlight and you're getting some movement.
I mean, if I could design a school.
Indeed, indeed. Yeah,
Um,
but I think I'll just put an asterisk to say, it, it's to that mom, to that child, don't presume that the pill is your answer. It is
yeah.
it is going to help you. So I am not opposed to young people being put on the pill so that they can have some control over their life, so that they're not
Yeah.
having some crazy breakthrough bleeding. They've got some sense as to what's going to happen, but it is not addressing the underlying problem. That
Yep.
so it's a both and. It's not just take the pill and you're good to go, and we'll see you again when you're in your 30s wondering why nothing's changed.
Yeah.
Yeah.
Yes, I think that is such an important message, because unfortunately, most of the patients that I see that have PCOS are not really doing anything besides taking the pill,
Right.
and not at their own fault, but they just don't know. They don't have the, the information or the awareness. So that is such an important part, that there's, so much more you can do to improve the baseline, protect future fertility,
Mhm.
or like increase your chances of, being successful with fertility later in life. So
Absolutely, yeah, and just increase your overall health. I'm going
yes,
to put a plug in, if I may, for a colleague's book.
yes.
It's been out for a decade or more, but it's called 8 Ways to Reverse Your PCOS. Dr. Fiona McCulloch up in Canada wrote this book, and I love it because it's dense. I mean, it's got lots of information, but it's digestible, so you
Yeah.
can really get through it. So I would say, just learn about what is PCOS, because again, we
Yes.
hear these diagnoses, we get the prescription, and we think, okay, we're done.
Right.
But to reiterate, you only have that diagnosis because we needed to name it,
Yeah.
to file an insurance claim for it,
Yep.
so that
Hmm.
we could prescribe for it. But what happened to cause it, and how can we reverse that?
Yep. Absolutely. Well, Susan, thank you so much for coming on. Can you tell everyone how they can find you?
Certainly. If you're in California, and particularly in Northern California, my website is drsusanfox.com, drsusanfox.com. If you're outside of California and you're interested in the course that I had mentioned, the website is healthuniversity.co. And Health University is spelled YOU. Now,
Mhm.
if that's too much, you can find it through the drsusanfox.com. It's just going to take a few clicks. But there's a fertility quiz, a 5-element fertility quiz for free. There's a free masterclass on gently detoxing, what to get out of your pantry shelves or out of your bathroom cabinet and so forth, to improve your whole health and your fertile health.
Amazing. Well,
Yeah,
thank you so much for coming on.
it's
Appreciate
it's
you.
been my pleasure. Thank you so much for having me.
All right. Thanks for listening, everybody. Thank you for tuning in to this episode of the Little Brain Campaign podcast. If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode. Please take a moment to leave a review while you're still thinking about it. It really helps grow the podcast, and I love hearing from our listeners. See you next time.